Hello and welcome to this awesome lighting. I know I look like I have a unibrow and I look pretty evil, but that's because I have my iPad here with my notes on it. So I just wanted to I made this video and it was 18 minutes, so now I'm going to try to cut it down without editing. So like I had mentioned before, I did my history of my chronic illnesses, kind of like the backstory of what's going on. So they did testing and they confirmed that I have dysautonomia. Dysautonomia is an umbrella term for 15 different types of autonomic dysfunction, including autonomic dysreflexia, which is a spinal cord injury thing that I can actually make a video about. I'm very well versed on autonomic dysreflexia. But I have postural orthostatic tachycardia syndrome with cardiovagal autonomic impairment. I don't know that much. I'm not well versed on cardiovagal autonomic impairment. However, I will be talking about POTS, which is the postural orthostatic tachycardia syndrome. A syndrome is not a disease. It is a group of symptoms. So, as far as how did I get this, it's actually unknown. There's several theories out there. It can be idiopathic, autoimmune, especially people with hypothyroidism, connective tissue disorders like Ehlers-Danlos syndrome, viruses like long haul COVID. Other viruses aside from COVID can cause POTS. As far as what it does, it essentially is saying that there is not enough norepinephrine in the legs in order to constrict the blood vessels, so then blood pools in the legs. So autonomic dysfunction, just to kind of give you like a little bit of a background about your nervous system. So you have your motor nerves and you need your brain to, so like if I want to say, I'm going to go and I'm going to wave to somebody, I have to tell my brain, and my brain then responds and then makes my motor neurons respond. Whereas the autonomic nervous system is exactly what it says. It's automatic. You have two different types. You have the sympathetic and the parasympathetic. Your sympathetic is your fight or flight response, and your parasympathetic, so your sympathetic, fight or flight. Parasympathetic is your rest and digest, okay? So it's just a very brief overview. I know there's a lot more to it than that, but so what does it affect? It affects your blood pressure, your heart rate, your temperature, and your GI system. So I don't sit there and I don't go, okay, heart, are you beating in there? You better start beating. Keep beating. My brain is not telling it to continue to beat. It just does it. Okay, it's an automatic response. As far as symptoms with POTS, you can have high or low blood pressure, high or low heart rate, chest pain, dizziness, neck pain, which is called the hanger sign, lightheadedness, brain fog, fainting, which is a big one for people, fatigue. Sometimes people will brown out also or have tunnel vision. Abdominal pain, temperature deregulation, so too hot or too cold, nervousness, agitation, blurred vision, headaches, insomnia, tremors, acrocyanosis, which is so what I had mentioned previous, when I was stark blue, my legs were stark blue, that's acrocyanosis. Exercise intolerance, and that means the wrong exercise. Excessive or lack of sweating, diarrhea and or constipation. So depending on what system is being bothered, it can actually flip back and forth, and I'll kind of explain that. So how's it diagnosed? It's autonomic function testing with the history of what's going on. So they really do take a really good history of kind of your signs and symptoms, and they do a neurological assessment, and then they take you and do autonomic function testing. There's 4 different types of testing. There's deep breathing, so you follow an arrow and you inhale when the air goes up and exhale, and it has to be 100% effort. Full inhalation, full exhalation. What should happen is your heart rate should go increase on inhalation and decrease on exhalation. So it should really look like this. Big old waves. For people like me, so this is the cardiovagal autonomic impairment. It really went more like this, or it goes like that, and it's pretty flat, meaning the heart rate didn't change when I breathed in deep and exhaled deeply. I know I look creepy. Anyways. QSART. It's a form of a sweat test. So they put pods on with acetylcholine in it, and they're all over they're on certain parts of your body. So like one's on your wrist, there's I think 2 on your feet and 1 on your leg. I don't remember. And what that does is it stimulates for you to sweat. Acetylcholine will trigger sweating, and they measure the amount of sweat that you sweat. Some people will have delayed sweating, others will have too much sweat or not enough sweating, or people will be perfectly normal. Valsalva maneuver. So that's taking a deep breath in and exhaling against pressure. So it kind of feels like you're going to take a bowel movement. I actually passed out on this one. I was just way too good at it. That is actually a very normal response because your heart rate decreases significantly. We use it in the hospital to get people out of SVT sometimes, to get their heart going back into a slower rhythm. Let's see. Oh, and the tilt table. The tilt table is the biggest one. That's kind of your definitive diagnosis for POTS. So you lay down for 5 minutes or a certain amount of time. I really don't know because we did all the testing all at once, and then the tilt table was the last part of it. So you lay down, they get your resting heart rate and your resting blood pressure, and then they sit you up. And for me, it was for 10 minutes. They do it at a 70-degree angle. If you're at 90, you're using muscles, and when you're using muscles in your legs, it's helping with the blood pressure and the heart rate. And so they were trying to make it as passive as possible, so you're not engaging those muscles. So normally for a normal person, you have your resting heart rate, and then you come back up, you sit up, and when you sit up, your body will be fighting against gravity, and so your heart rate will increase 10 to 15 beats per minute, and your blood pressure will do, I believe it's going to go down for a second and then come back up, because again, it's fighting against gravity. But don't quote me on that. I may be wrong on that, but I definitely know the heart rate will go up 10 to 15 beats, and then eventually it'll even out the longer that you stand. For people like me, so my resting heart rate is anywhere between 60 to 65 beats per minute. On 30 seconds of standing, I was at 35 over my resting heart rate. And instead of like evening back out, it went up and it went up and it went up. And then my blood pressure, so like I said, I believe it's supposed to go down and then even out. I could be wrong. Mine didn't do anything. And that's also a very classic sign. So at the end, my heart rate was 77 beats above my resting. And so again, that's very abnormal. You're just from standing, your body shouldn't have to be working that hard. It's like your body is trying to compensate for something that it doesn't need to compensate for, the longer that you're standing. But because the blood is pooling in your feet, then obviously that's the reason why, because it's like constantly trying to get more blood up to the heart so then it can then go to other parts of your body. But if it's just staying in your feet, it's not going anywhere, and the heart just keeps on trying to work hard. As far as treatment, so there's lifestyle change, and then there's medication. And so as far as lifestyle change, I actually prefer to do lifestyle change over medications. And usually if you have a good doctor, that's what they're going to go for. They're going to go for, let's see if we can make some lifestyle changes before we add medication. Sometimes you do need medication on top of lifestyle changes, but it's important to add in those lifestyle changes. First one being increasing the amount of salt that you take. So daily recommended dose is 2 to 3 grams for the normal person. I have to be anywhere between 3 to 6 grams, which is a lot. I mean, just think that's 2 to 3 times more than the daily value or the recommended value. I have seen that some people have to take 8 to 10 grams of salts, which is astronomically high. Again, that's like 4 to 5 times recommended value. So that's a lot of salt. But it's because you're trying to retain that fluid, to get enough fluid to have your heart pump. Your heart needs something to pump, what I'm trying to say, to increase your fluid intake. So again, daily value normally for normal people is anywhere between 1.5 to 2 liters. Mine is 2 to 3, so that's actually not too bad. Small frequent meals, because you don't want to overload your stomach. If you stretch your stomach too much and your body then has to then churn up that food and then get it out, it's requiring more blood to go to your stomach when it's in your legs. Exercise is huge, and again, it's the right kind of exercise. So they have what's called the Levine Protocol. I believe it's from either the Mayo Clinic or it's from CHOP. I'm not entirely sure. But you start horizontal exercising, so your blood is even, and then eventually, after several months, you start doing upright exercise. And then compression devices. So thigh-high compression socks. I have knee-high on, and that's just because I'm a nurse and we wear compression socks all the time. I'm currently wearing unicorn ones, and I really wanted to show you, but it's dark out right now. And then an abdominal binder. They actually have found that abdominal binders work really, really well for people who have POTS. I do have stomach pain, so it can be kind of annoying to try to wear an abdominal binder, and sometimes I just can't do it. Some people need IVs. That just all goes in with fluids if you can't get enough fluids into your system. So as far as medication, blood pressure medications, beta blockers, and steroids. So propranolol, so if you have a hyperadrenergic response, which is, like I said, your sympathetic nervous system kind of going out of whack, that fight or flight response that decides to make your blood pressure go really high and your heart rate really high, the propranolol can help decrease that blood pressure. Catapress is it helps with blood vessel constriction, and so if you take catapress, that will again help with circulating the blood. And then lastly, the steroids, the most common is Florinef, which again retains fluid. So I hope that was a pretty comprehensive rundown of what POTS is, Postural Orthostatic Tachycardia Syndrome. Not a lot of people are going to know about it in the nursing community or even doctors, but it is seen more and more now that there is COVID long haul. So I figured I'd go ahead and share that with you. Next time I will be talking about my other chronic illness that's kind of tied in with pots. All right, talk to you later.